ठीक है, आगे पढ़ते हैं हम लोग। सो कहाँ तक पढ़ लिया था हम लोगों ने? रिस्क ग्रुप पढ़ रहे थे। तो रिस्क ग्रुप कौन होते हैं? लेट्स रीड दिस। So, another approach developed and promoted by WHO is to identify precisely the risk group or target group. Example: at risk mother, at risk infant, at risk family, chronologically, chronically ill, handicapped, in elderly. So, in the population by certain defined criteria and a direct appropriate action to them first. This is known as the risk approach. It has been summed, hi Shashank, it has been summed up as something for all but more for those in need. ठीक है, रिस्क अप्रोच क्या होता है? जैसे कि मदर्स है, या एट रिस्क इन्फेंट है, एट रिस्क फैमिली है, क्रॉनिकली इल पेशेंट है, हैंडीकैप है, एल्डरली है, इनको ज़्यादा डायरेक्ट अप्रोच एक्शन उनकी तरफ लगाना है, तो इसको हम लोग बोलते हैं रिस्क अप्रोच। जो एट रिस्क पॉपुलेशन है उनको ज़्यादा अप्रोच करना है। सो समथिंग फॉर ऑल बट मोर फॉर दोज इन नीड, इसको बोलते हैं, इन प्रपोर्शन टू द नीड. In essence, the risk approach is a managerial device for increasing the efficiency of healthcare services within the limit of existing resources. WHO has been using the risk approach in MCH services since a long time. गाइडलाइन फॉर डिफाइनिंग एट रिस्क पॉपुलेशन, बायोलॉजिकल सिचुएशन में क्या क्या आ जाएगा? एज ग्रुप जैसे इन्फेंट, लो बर्थ वेट, टॉडलर्स, एल्डरली. सेक्स जैसे फीमेल इन द रिप्रोडक्टिव एज पीरियड. फिजियोलॉजिकल स्टेट, प्रेगनेंसी, कोलेस्ट्रॉल लेवल, हाई ब्लड प्रेशर, जेनेटिक फैक्टर, फैमिली हिस्ट्री ऑफ जेनेटिक डिसऑर्डर. देन अदर हेल्थ कंडीशन जैसे डिजीज, फिजिकल फंक्शनिंग, अनहेल्दी बिहेवियर. ये सब बायोलॉजिकल सिचुएशन में आ जाएगा ना. फिजिकल सिचुएशन क्या हो जाएगा? रूरल, अर्बन, स्लम, लिविंग कंडीशन, ओवर क्राउडिंग, इन्वायरमेंटल, वाटर सप्लाई, प्रॉक्सिमिटी टू इंडस्ट्रीज. नाउ सोशियो इकोनॉमिक एंड कल्चरल सिचुएशन क्या आ जाएगा? सो सोशल क्लास, एथनिक एंड कल्चरल ग्रुप, फैमिली डिसरप्शन, एजुकेशन, हाउसिंग, कस्टम हैबिट्स एंड बिहेवियर्स जैसे smoking, lack of exercise, overeating, drug addict. Hi, mummy. So, access to health services and lifestyle and attitude. These are at risk populations. So, risk approach इनमें हम लोग लगाते हैं. So, modern epidemiology is concerned with the identification of risk factor and high risk groups in population since so since resources are scarce, identification of those at risk is imperative. It helps to define priorities and points to those most in need of attention. The knowledge of risk factor and risk group can be used to prevent disease in so far as we are able to remove or minimize the risk. So spectrum of disease क्या होता है? So the term spectrum of disease is a graphic representation of variation in the manifestation of disease. It is akin to spectrum of light where the colors vary from one end to the other, but difficult to determine where one color ends and the other color begins. So at one end of the disease spectrum are subclinical infections which are not originally identified, and at other end are fatal illnesses. So, in the middle of the spectrum lies illness ranging from severity from mild to severe. These different manifestations are simple reflections of individuals' different state of immunity and receptivity. So, leprosy is an excellent example of the spectral concept of disease. For almost every disease, there exists a spectrum of severity, with fewer exceptions, such as rabies. In infectious disease, the spectrum of disease is also referred to as gradient of infection. So, the sequence of event in the spectrum of disease can be interrupted by early diagnosis. ठीक है, early diagnosis and treatment, or by preventive measures which, if introduced at a particular point, will prevent or retard the further development of the disease. Hi. The concept of spectrum of disease provides for inclusion of all cases, both subclinical and clinical, in the study of disease. So आइसबर्ग ऑफ डिजीज़ क्या होता है? आइसबर्ग फेनोमेनन भी कहते हैं, जैसे हाइपरटेंशन, डायबिटीज़, ये सब को आइसबर्ग कहा जाता है, क्योंकि मोस्ट ऑफ द केसेस आर नॉट डायग्नोस्ड. जो डायग्नोस्ड है वो बहुत कम है, 5% ओनली. So, a concept closely related to the spectrum of disease is the concept of iceberg phenomenon of disease. According to this concept, disease in a community may be compared with an iceberg. The floating tip of the iceberg represents what the physician sees in the community, that is, clinical cases. These are the clinical cases. The vast submerged portion of the iceberg represents the hidden mass of disease. That is latent, inapparent, pre-symptomatic, undiagnosed cases and carriers in the community. The waterline represents the demarcation between apparent and inapparent cases. So, in some diseases, जैसे hypertension, diabetes, anemia, malnourishment, mental illness, the known morbidity, that is the submerged portion in the icebergs, far exceeds than the known morbidity. The hidden part of the iceberg thus constitutes an important undiagnosed reservoir of infection or disease in the community, and its detection and control is a challenge to modern technique in preventive medicine. One of the major deterrent in the study of chronic disease of the unknown etiology is the absence of method to detect the subclinical state, the bottom of the iceberg. इसको डिटेक्ट नहीं कर पाते, यही हमारा लूपहोल है. ठीक है. सो कंसेप्ट ऑफ कंट्रोल क्या होता है? डिजीज कंट्रोल. द टर्म डिजीज कंट्रोल describes ongoing operation aimed at reducing the incidence of disease. Disease control is the incidence of disease को reduce करना है, the duration of disease, consequently the risk of transmission, इसको reduce करना है, the effect of infection, including both the physical and psychosocial complications and financial burden of to the community. So, control activities may focus on primary prevention or secondary prevention. Most control programs combine the two. Primary या secondary? Secondary prevention क्या होता है? वही ट्रीटमेंट एंड एवरीथिंग ना. प्राइमरी इसके रिस्क फैक्टर को आप कम करोगे. द कंसेप्ट ऑफ टर्शरी प्रिवेंशन इज कंपेरेटिवली लेस रेलिवेंट टू कंट्रोल एफर्ट्स. In disease control, the disease agent is permitted to persist in the community at a level where it ceases to be a public health problem according to the tolerance of the local population. A state of equilibrium becomes established between the disease agent and host and environment component of the disease process. An excellent embodiment of this concept is malaria का control, which is distinct from the malaria eradication. ठीक है, तो मतलब हम लोग उतना तक रह जाएंगे जहाँ पे मलेरिया है, बट दैट्स नॉट अ पब्लिक हेल्थ प्रॉब्लम एनी मोर. इक्विलिब्रियम रीच कर गया है. तो मलेरिया को कंट्रोल करना और मलेरिया को इरेडिकेट करना इज़ टू ए डिफरेंट थिंग. सो डिजीज़ एलिमिनेशन क्या होता है? Between control and eradication, an intermediate goal has been described as regional elimination. The term elimination is used to describe interruption of transmission of disease. Transmission को रोक देना है. As for example, elimination of measles, polio, diphtheria, यानी कि इसको आगे बढ़ने से रोकना है. Elimination का यही मतलब होता है. form large geographical from large geographical regions or areas. Regional elimination is now seen as an important precursor of eradication. Hello, Laura, and I do not understand the language that you are speaking. So, we are reading about disease elimination. Disease elimination is when you stop the disease from transmitting from the case to another person, from one person to another person. When you stop the transmission, that's known as disease elimination. What is disease eradication then? So, eradication literally means tear out by root. Tear out by root, matlab, you have to take out the disease altogether. Cases B you have to take out. So eradication of disease implies termination of all the transmission of the infection by uh, extermination of the infectious agent, and as the name implies, eradication is an absolute process and not a relative goal. It is all or none phenomenon. The word eradication is reserved for cessation of infection and disease from the whole world. Today, smallpox is the only disease that had been eradicated globally. Every disease, like every human being, is unique with its own epidemiological characteristic and specific strategies for control. Now, during recent year, three diseases have been seriously advanced as कैंडिडेट फॉर ग्लोबल इरेडिकेशन विद इन द फोर्सी फ्यूचर. कौन सा तीन डिजीज़ है जिसको हम लोग फ्यूचर में ऐसा देख रहे हैं कि पूरी तरीके से पूरी दुनिया से ख़त्म हो जाएगा? दैट्स पोलियो, मीजल्स एंड ड्रैकुलियासिस. The feasibility of eradicating polio appears to be greater than that of others, and the goal is in sight, as Afghanistan and Pakistan are the only two countries endemic for poliomyelitis at present. Polio, we are thinking about eradicating polio. बस दो कंट्री अफगानिस्तान और पाकिस्तान है जहाँ पे पोलियो है, वरना बाकी जगह हर जगह से हट गया है. Now, experience gained from eradication program, example malaria, yaws, have shown that once the morbidity of disease reaches a very low level, a residual infection usually persists in a population, leading to a state of equilibrium between the agent host and the environment component of the disease process. In this situation, there are always hidden foci of infection, unrecognized methods of transmission, and resistance of the vector of or organism. So, all of which flare up when the agent host environment equilibrium is disturbed. Failure to understand this leads to disappointment in the eradication program mounted against malaria, yaw, plague, kala azar, yellow fever. Now, monitoring and surveillance. Monitoring and surveillance क्या होता है? According to the standard dictionaries, the word monitoring and surveillance are almost synonymous, but in public health practice, they have taken on rather specific and somewhat different meanings. Monitoring क्या होता है? Monitoring is the performance and analysis of routine measurement aimed at detecting changes in the environment of health status of population. डिटेक्टिंग चेंजेस इन द एनवायरनमेंट और हेल्थ स्टेटस ऑफ अ पॉपुलेशन. हम लोग क्या मॉनिटर करेंगे? देखेंगे कि हेल्थ स्टेटस और इन्वायरमेंट किस तरीके से चेंज कर रहा है. दस वी have monitoring of air pollution, water pollution, growth and nutritional status, etc. Now, it also refers to the ongoing measurement of performance of health services and health or a health professional, or of the extent to which patients comply with or adhere to advice from health professional. In management, monitoring refers to as the episodic oversight of the implementation of an activity, seeing to oversee the input, deliveries and work schedules, targets, outputs, and other required action for the proceedings of according to the plan. So it keeps track of the achievement, staff movement, and utilization, supply, and equipment, and the money spent in realization of the resource available so that if anything goes wrong, immediate corrective measures can be taken. अब देखते हैं सर्विलेंस क्या होता है. Surveillance is defined in many ways. So, continuous analysis, interpretation, and feedback of systemically collected data, generally using methods distinguished by their practicality. So, what is surveillance? इस सर्वेलेंस मतलब होता है कंटिन्यूस एनालिसिस. हम लोग उसमें बस डेटा कलेक्ट कर रहे हैं, इसमें एनालिसिस कर रहे हैं, इंटरप्रिटेशन कर रहे हैं, फीडबैक दे रहे हैं ऑफ सिस्टमिकली कलेक्टेड डेटा, generally using methods distinguished by their practicality, uniformity, and rapidity rather than by accuracy and completeness. So, by observing trends in time, place, and person, and changes can be observed or anticipated, and appropriate action, including investigation and control measures, can be taken. So, sources of data may relate directly to disease or to factors influencing disease. Thus, they may include mortality and morbidity reports based on death certificate, hospital records, general practices, sentinels and or notification, laboratory diagnosis, outbreak report, vaccine uptake and side effect signal, absentees records, changes in the disease agents, vectors or reservoirs, serological surveillance through serum banks, and later can also be seen as an example of biological monitoring. Hey Shashank, I have an idea. What we can do is I have all the question papers. I'll send that to you. You send that to your papa, and then ask him to print all those question papers. And once he prints that, I'll get hard hard copy of the question papers. That will be easier for me to study. Can you do that for me? So let's move ahead. Systemic and continuous collection, analysis, and interpretation of data closely integrate with timely and coherent dissemination of the records and assessment to those who have the right to know so that the action can be taken. It is an essential feature of epidemiological and public health practice. So, the final phase in the surveillance chain is the application of information to health promotion and disease prevention and control. A surveillance system includes a functional capacity for. Hey, Ashish. Hi. Hi, Ashish. Hello, mummy. मम्मी देखो आशीष आया है. He always says keep it up. So, thank you, Ashish. So, आगे पढ़ते हैं. So, a surveillance system includes the functional capacity for data collection, analysis, and dissemination. Yes, I'm studying. कितना अजीब लग रहा होगा ना, मेरा हंसी आ रहा होगा और सामने में बुक होगा. ओ माय गॉड. सो सर्विलेंस सिस्टम इंक्लूड्स. देखो आशीष, हम एक चीज़ बता दें तुमको. हाय शशांक. सो मैं एक चीज़ बता देती हूँ तुमको. मॉनिटरिंग और सर्विलेंस क्या होता है. मॉनिटरिंग इज़ जस्ट कलेक्शन ऑफ डेटा कि आपका एयर पोल्यूशन कितना हो रहा है, वाटर पोल्यूशन कितना हो रहा है. सर्विलेंस इज कंटिन्यूस एनालिसिस, इंटरप्रिटेशन और फीडबैक अगर तुम दे रहे हो तो दैट्स नोन एज सर्विलेंस. ठीक है. Public health program, it is often distinguished from monitoring by the notion that surveillance is continuous and ongoing, whereas monitoring tends to be more intermittent or episodic. So, surveillance programs can assume any character and dimension. Thus, we have epidemiological surveillance, demographic surveillance, nutritional surveillance. So, according to the above definition, monitoring becomes one specific and essential part of the broader concept embraced by surveillance. Monitoring requires careful planning and the use of standardized procedures and method of data collection and then be carried out over extended period of time by technicians and automated instrumentations. Surveillance and contrast requires professional analysis. अब तो ये सब चैट जीपीटी कर देगा. एनालिसिस चाहिए, sophistication judgment of the data leading to the recommendation for control activities. Now sentinel surveillance क्या होता है? So no routine notification system can identify all cases of infection or disease. कोई भी रूटीन नोटिफिकेशन जो है ना वो आइडेंटिफाई कर लेगा ऑल केसेस ऑफ, मतलब कोई भी ऐसा नोटिफिकेशन जो है वो आइडेंटिफाई नहीं कर पाएगा ऑल द केसेस ऑफ इन्फेक्शन एंड डिसीज. अ मेथड फॉर आइडेंटिफाइंग द मिसिंग केसेस and thereby supplementing the notified cases is required. This is known as sentinel surveillance. Sentinel surveillance क्या होता है शंक? कि तुम सारे केसेस को नहीं ट्रैक कर पाओगे, तो जो मेथड जो होता है जिससे हम लोग आइडेंटिफाई करेंगे मिसिंग केसेस को और उनको सप्लीमेंट करेंगे, उसको सेंटिनल सर्वेलेंस कहते हैं. द सेंटिनल डेटा इज एक्सट्रापोलेटेड टू द एंटायर पॉपुलेशन टू एस्टिमेट द डिजीज प्रेवलेंस. जो छूट गए हैं उनको भी ऐड कर देंगे, उसके बाद हम लोग एस्टिमेट निकालेंगे डिजीज प्रेवलेंस का इन द टोटल पॉपुलेशन. द एडवांटेज ऑफ सच अ सिस्टम इज दैट द रिपोर्टिंग बायसेस आर मिनिमाइज्ड एंड द फीडबैक ऑफ इंफॉर्मेशन टू द प्रोवाइडर इज सिंप्लीफाइड. Thank you, mommy. So sentinel surveillance जो होता है ना, agencies could be interested and competent physically or institutions in selected areas to report the cases of disease in the area. This system would provide more valuable and detailed information than could be obtained from the traditional notification system. Finally, this sentinel site could be developed into a notification system for providing more detailed information, which in some setting may be less costly than developing and maintaining an ongoing notification system. So evaluation of control क्या होता है? Evaluation is the process by which results are compared with the intended objective and more simplified the assessment of how well a program is performing. Evaluation should always be considered during the planning and implementation stage of a program or activity. So evaluation may be crucial in identifying the health benefits derived, impact on mobility, mortality, sequelae, patient satisfaction. Evaluation can be useful in identifying performance difficulty. Evaluation studies may also be carried out to generate information for other purposes, जैसे कि to attract attention to a problem, extension of control activities, training and patient management. The principle of evaluation are discussed in chapter 23. सो कंसेप्ट ऑफ प्रिवेंशन अब हम लोग पढ़ने जा रहे हैं. वो है ना प्रिमोडियल प्रिवेंशन एंड ऑल ऑफ दैट, वही पढ़ने जा रहे हैं. फिर मोड ऑफ इंटरवेंशन रहेगा. फिर पॉपुलेशन मेडिसिन होगा. फिर हॉस्पिटल एंड कम्युनिटी होगा. फिर डिजीज़ क्लासिफिकेशन हो जाएगा. चलो जल्दी जल्दी करते हैं. ये जल्दी जल्दी इसी ये में कंप्लीट दिस और उसके बाद दूसरे चैप्टर में विल गो ऑन. इसके बाद हम लोग टीवी पढ़ लेंगे. टीवी का जो वो है ना प्रोग्राम, विल रीड दैट, ठीक है, एंड देन आई स्लीप. So, concept of prevention care. The goal of medicine are to promote health, to to preserve health, to restore health when it is impaired, and to minimize suffering and distress. These goals are embodied in the word prevention. Successful prevention depends upon a knowledge of causation, dynamic of transmission, identification of risk factor and risk group, availability of prophylactic or early detection and treatment measures, and organization for applying these measures to appropriate prevention or group, and continuous evaluation of and development of procedures applied. So it is not necessary, although desirable, to know everything about the natural history of a disease to initiate preventive measures. Oftentimes, removal or elimination of a single known essential cause may be sufficient to prevent a disease. So, the objective of preventive medicine is to intercept or oppose the cause and thereby the disease process. This epidemiological concept permits the inclusion of treatment as one of the modes of intervention. Level of prevention क्या है? So the modern day the concept of prevention has become broad based. It has become customary to define prevention in the terms of four levels: primordial prevention, primary prevention, secondary prevention, tertiary prevention. So these level of prevention are shown in table 10. In relation to the natural history of the disease, authorities on the preventive medicine do not agree on the precise boundaries between these levels, but that does not minimize their importance. For example, the supply of food supplementation supplements to a family could be a primordial prevention for some members and secondary prevention curative for others. These differences of opinion are more semantic than substantive. A general discussion of these concepts are given below. So आगे बढ़ते हैं कि प्रिमोडियल प्रिवेंशन क्या होता है. द प्रिमोडियल प्रिवेंशन, अ न्यू कंसेप्ट, इज रिसीविंग स्पेशल अटेंशन इन द प्रिवेंशन ऑफ chronic diseases. This is primary prevention in the purest sense. That is prevention of the emergence of or development of risk factor in countries or population group in which they have not yet appeared. अगर risk factor अभी तक appear भी नहीं किया, उसको हम लोग को prevent करना है. For example, many adult health problems, example obesity, hypertension, have their early origin in childhood because this is the time when lifestyles are formed. For example, smoking, eating pattern, physical exercise. In primordial prevention, efforts are directed towards discouraging children from adopting harmful lifestyle. The main intervention in primordial prevention is through individual or mass education. Primordial mainly होता है individual या फिर mass education से. Education से we can change their habits, and that's how primordial prevention is done. Now let's move on to primary prevention. Primary prevention क्या होता है कि risk factor अगर आ गया है तो उसको हटाना है या something. So primary prevention can be defined as disease नहीं आने देना है. हाँ, risk factor आ गया, disease नहीं आने देना. So primary prevention can be defined as action taken prior to the onset of the disease, which removes the possibility that a disease will ever occur. It signifies interventions in the pre-pathogenic state of the disease or health problem, जैसे कि low birth weight or other departures from health. Now, primary prevention may be accompanied by measures designed to promote general health and well-being and quality of life of people, or by specific protection measures. These are discussed in detail elsewhere under mode of intervention. So primary prevention is far more than averting the occurrence of a disease or prolonging life. It includes the concept of positive health, a concept that encourages achievement and maintenance of an acceptable level of health that will enable every human individual to lead a पॉजिटिव हेल्थ एक है जो encourage करेंगे अचीव और मेंटेन करने के लिए एक्सेप्टेबल लेवल ऑफ हेल्थ इंडिविजुअल के लिए टू लीड अ सोशली एंड इकोनॉमिकली प्रोडक्टिव लाइफ इट कंसर्न्स an individual's attitude towards life and health and the initiatives he take about positive and responsible measure for himself, his family and his community. The concept of primary prevention is now being applied to prevention of chronic diseases such as chronic heart disease, hypertension, and cancer based on elimination or modification of risk factors. The WHO recommended the following approach uh, for the prevention of chronic disease where the risk factors are established. Population यानी mass strategy, high risk strategy. पॉपुलेशन स्ट्रैटेजी क्या होता है और हाई रिस्क स्ट्रैटेजी क्या होता है? पॉपुलेशन स्ट्रैटेजी ये होता है कि अनदर प्रिवेंटिव अप्रोच इज पॉपुलेशन स्ट्रैटेजी विच इज़ डायरेक्टेड एट the whole population irrespective of individual risk. For example, studies have shown that even a small reduction in the average blood pressure and serum cholesterol of a population would produce a large reduction in the incidence of cardiovascular disease. The population approach is directed towards socio-economic, behavioral, and lifestyle changes. हाई रिस्क स्ट्रैटेजी क्या होता है? So what is high risk strategy? So the high risk strategy aims to bring preventive care to individuals at special risk. So this requires detection of individuals at high risk by the optimum use of clinical method. So the primary prevention is a desirable goal. It is worthwhile to recall the fact that the industrialized country succeeded in eliminating a number of communicable diseases जैसे कि cholera, typhoid, dysentery, and controlling several others जैसे कि plague, leprosy, TB. Not by medical intervention but mainly by raising the standard of living. ये सब डिजीज़ को कैसे कंट्रोल कर दिया? हाई रिस्क स्ट्रैटेजी जो है ना वो प्रिवेंटिव केयर पे बेस्ड ऑन है जो स्पेशल रिस्क में है. तो हाई रिस्क पॉपुलेशन को पहले आइडेंटिफाई करेंगे और उनको ऑप्टिमम मेथड देंगे. और पॉपुलेशन स्ट्रैटेजी जो है ना होल पॉपुलेशन पे बेस्ड ऑन है इररिस्पेक्टिव ऑफ इंडिविजुअल रिस्क. ठीक है, तो पहले हाई रिस्क पॉपुलेशन ढूंढ लेंगे फिर उनमें इंटरवेंशंस लाएंगे. स्टैंडर्ड ऑफ लिविंग बढ़ा देने से ये सब जो डिजीज़ है सब कम हो जाता है. प्राइमरी प्रिवेंशन है. And much of this success came even before immunization became universal routine. The application of primary prevention is the prevention of application of is the prevention of chronic diseases in a recent development. To have an impact on the population, all the above three approaches primordial prevention, population strategy, high risk strategy should be implemented as they are usually complementary. In summary, primary prevention is a holistic approach. It relies on measures designed to promote health or to protect against specific disease agent and hazard in the environment. It utilizes knowledge of the pre-pathogenesis phase of the disease, embracing the agent, host, and environment. Fundamental public health measures and activities such as sanitation, infection control, immunization, protection of food, milk, water supply, environmental protection, protection against occupational hazard and accident are all basic to primary prevention. Basic professional hygiene and public health measures have a major impact on halting communicable disease epidemic. Immunization, infection control, example hand washing, refrigeration of food, garbage collection, solid and liquid, and general sanitation have reduced infectious disease threat to the population. The safety and low level of preventive prevention justifies its wider application. Primary prevention has become increasingly identifies as health education and the concept of individual and community responsibility for health. ना सेकेंडरी प्रिवेंशन क्या होता है? So secondary prevention can be defined as action which halts the progress of disease as its incipient stage and prevention prevents complication. The specific intervention are early diagnosis, screening test, case finding program, and adequate treatment. Basically ये है early diagnosis and adequate treatment. By early diagnosis and adequate treatment, secondary prevention attempts to arrest the disease process, restore health by seeking out unrecognized disease and treating it before irreversible pathological changes have taken place and reverse communicability of the infectious disease. It may also protect others in the community from acquiring the infection and thus provide at once secondary prevention for the infected individual and primary prevention for the potential contact. Secondary prevention is largely the domain of clinical medicine. The health program initiated by government are usually at the level of secondary prevention. हेल्थ प्रोग्राम्स जो होता है ना वो सेकेंडरी प्रिवेंशन होता है health programs. Okay? The drawback of secondary prevention is that the patient has already been subjected to mental anguish, physical pain, and community to loss of productivity. These situations are not encouraged in primary prevention. Hello, mommy. So, secondary prevention is an imperfect tool in the control of transmission of disease. It is often more expensive and less effective than primary prevention. In the long run, human health, happiness, and useful longevity will be achieved far less expense with less suffering through primary prevention than through secondary prevention. Now tertiary prevention क्या होता है? When the disease process has advanced beyond its early stages, it is still possible to accomplish prevention by what might be called as tertiary prevention. It signifies intervention in the late pathogenesis phase. Tertiary prevention can be defined as all measures available to reduce the limit of impaired and disability, minimize suffering caused by existing departure from good health, and to promote the patient's adjustment to irremediable condition. For example, treatment, even if undertaken late in natural history of disease, may prevent sequelae and limit disability when detect and disabilities are more or less stabilized. Rehabilitation may play a preventive role. Modern rehabilitation includes psychosocial, vocational, medical components based on teamwork, form a variety of professionals. Tertiary prevention extends the concept of prevention into field rehabilitation. Now, मोड ऑफ इंटरवेंशन क्या होगा? सो टर्शरी में है कि जब डिसीज़ हो गया रिहैबिलिटेट कर देंगे तो किस तरीके से हम लोग रिहैबिलिटेट कर सकते हैं? इंटरवेंशन कैन बी डिफाइंड एज एन अटेम्प्ट टू इंटरवीन और इंटरप्ट द यूजुअल सीक्वेले in the development of the disease in man. This may be by the provision of the treatment, education, help, or social support. Five modes of intervention have been described, which form a continuum corresponding to the natural history of any disease. These levels are related to agent, host, and environment and are shown in figure this. So they are health promotion, specific protection, early diagnosis and treatment, disability limitation, and rehabilitation. Thank you guys.